Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT codes used to report this service. 73090, radiologic examination forearm, 2 views. X-rays showing 2 views of the lower arm, including the radius and ulna. These views are used to evaluate the radius, ulna, and adjacent elbow and wrist joints. Understanding the type and number of views is essential for accurate CPT code selection. Common views for the forearm series. AP view evaluates the radius and ulna in their anatomical relationship from the elbow to wrist. Lateral view demonstrates displacement, alignment, and soft tissue. PA view, alternative view for patients who cannot supinate, shows a PA view of the radius and lateral view of the ulna. Report example. Order exam, forearm 2 views left. Header, AP and lateral views of the left forearm history. Fracture. Comparison, 12/29/2022. Findings. Redemonstrated fracture proximal to the mid-radial shaft with similar dorsal angulation. Increased calcified callus and bony bridging. Impression. Healing left radial shaft fracture. Let's look at the views, AP and lateral. That's a total of 2 views. This qualifies for CPT code 73090, radiologic examination forearm. 2 views. Now let's choose the appropriate diagnosis code based on the clinical history and chart findings. Report findings state, healing left radial shaft fracture with dorsal angulation and visible callus formation. Based on radiology documentation, this is a follow-up imaging after an earlier confirmed fracture. The comparison study confirms it is not a new injury. Fractures not specified as open or closed are coded as closed. Fractures not specified as displaced or non-displaced are coded as displaced per ICD-10-CM coding guidelines. The clinical history and imaging report do not describe active treatment such as reduction or surgical intervention during this encounter. Therefore, the imaging represents a subsequent encounter with routine healing. Correct ICD-10-CM codes, S52.312D, displaced fracture of shaft of left radius. Subsequent encounter for fracture with routine healing. The documentation supports a healing fracture in the shaft of the radius. The side is specified as left, as per ICD-10-CM conventions. This is coded as displaced, and a subsequent encounter, D. Reminder, the 7th character must match the encounter type and be based on chart documentation, not just the radiology report. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.